take a deep breath, take the higher road. That's what they always say, as if they know the way. They won't take it from me. But don't ever doubt yourself, 'cause life ain't just a dream. You make your own, so kick and scream. The people will act with a never-ending force. You never had the chance, so what you waiting for? The day has come, my friend, 'cause this is war. It's time and this is war.
As we navigate through unprecedented times, the lingering effects of long COVID and concerns surrounding mRNA vaccine injuries have sparked a growing interest in exploring alternative approaches to support recovery and healing. In the wake of these challenges, individuals are seeking innovative and holistic solutions that complement traditional medical interventions and address the unique needs of those experiencing long-term symptoms or adverse reactions. Alternative therapies offer a ray of hope for those grappling with the debilitating effects of long COVID, providing a diverse range of modalities that focus on restoring balance to the body, mind, and spirit. From acupuncture and herbal medicine to energy healing and mind-body practices, alternative therapies offer a personalized and integrative approach to addressing the complex symptoms associated with long COVID. Similarly, in the context of mRNA vaccine injuries, alternative therapies present a promising avenue for alleviating discomfort, promoting recovery, and supporting the body's innate healing mechanisms. By embracing these holistic and complementary modalities, individuals can access a wealth of resources and tools to navigate their health challenges with resilience, empowerment, and hope. In this next hour, we will delve into the transformative potential of alternative therapies for long COVID and mRNA vaccine injury, and discover how these innovative approaches are reshaping the landscape of health and well-being in the face of adversity. You're listening to Nurses Out Loud on America Out Loud Talk Radio. I'm your host, Nurse Kimberly Overton. Before we get started today, I do want to encourage our listeners, if you have questions or comments, or perhaps you want to share your own experiences with what you're seeing on the front lines of healthcare, you can now submit those to us by sending them directly to nurses@americaoutloud.com. We will be featuring your questions and comments every Friday on a special Q&A episode with the nurses. We encourage all of you to engage in the battle and find your voice in this fight. But until you are able to do that, we will continue to be that voice for you. For over 20 years, my next guest has had a passion for natural, holistic, and health solutions, including aromatic plants, herbs, and homeopathic remedies. This led her down a path of continued research. She began formulating in 2002. In 2014, a documentary called Water Memory was released, and she began exploring the work of Professor Luc Montagnier. His work inspired her to focus on electronic homeopathy, structured water, and the positive power of electromagnetic waves of different frequency. She has committed her life to continuing this important research. Jen Dillon is a natural product formulator and researcher. She has an extensive background working with plant-derived ingredients, homeopathy, and structured water. She is known for developing H2O frequency water, the first structured water available for resale in a bottle, and most recently developed the homeopathic detox protocol. This is reportedly helping many people with long-term COVID symptoms and adverse mRNA vaccine reactions. This protocol is currently in a privately funded non-medicinal case study supported by both holistic health practitioners and Western medical professionals in Canada and the US. Jen, welcome to the show. Thank you so much for being here with me today.
Thank you, Kimberly. I appreciate the opportunity.
Yeah, I'm really excited to have you on. We connected a while back through the work that I do with Remnant Healthcare, and we were introducing homeopathy as part of what we are offering to our clients. And I honestly don't even remember now who connected us, but I feel incredibly blessed that we were connected, however that connection was made. Because when I started hearing about your homeopathic detox protocol, I was just so encouraged in what we could offer to our clients who are suffering with the symptoms of long COVID and vaccine injury. But, before we get into that, I just really want to know what inspired you to delve into the natural product formulation in general and this research, particularly focusing on this detox protocol?
Well, I'm a spiritual person, Kimberly, and a lot of my work has been guided throughout my life, but the natural realm was my path since my early 20s. So I have 4 children, and my 2 younger children, they're 14 and 15 years old, have never been vaccinated with any vaccine.
Yes.
Because I did everything through holistic homeopathy, and we've never really needed to go any other route, because I've just lived and breathed this for so long. So in my 20s, I was introduced to homeopathy. I was living in California, actually, at the time, and then later moved to Canada and lived there for 15 years, where I even got more immersed in homeopathy. But everyone in my family thought I was a nut job at first. It's funny.
Yeah, we get
My
that
brother, my parents, I'm here I am in the early 90s and late 90s talking about, not eating anything that's not organic. And I'm talking about, not taking pharmaceuticals. And so I was the oddball. I was definitely the oddball in my family. It's interesting, though, times have changed and everybody's so open to this. I mean, homeopathy has been practiced for centuries, literally. And it's well known that the royal family has used homeopathy for a very long time. And
Right.
That's just something that Western medicine has kind of shunned on. They call it kooky. It's interesting. If you go to India, you'll learn a lot about it. And
The Banerjee protocols come out of India. Is that correct?
well, yes. I mean, my form of homeopathy that I'm practicing currently, or formulating rather, because I'm not actually a practicing practitioner. My work I started studying frequencies like Rife's frequencies about 15 years ago. And then when Water Memory came out in 2014, which I highly recommend everyone watch, prior to that, I'd been using traditional homeopathy. And then I was like, everybody has a frequency, everybody's energy. And then I kind of shifted, and I'm like, I'm going to start practicing this on my family and friends and see what kind of results I get. And my work took a turn, and I was really grateful for the work that Luke did. He's no longer with us, but he's definitely a huge inspiration in my work. So
Absolutely. And we'll definitely make sure that we get a link to that documentary, Water Memory. We'll include it in our show notes that will accompany this episode, because I'd like to see it myself, and certainly would encourage the listeners to watch the documentary that certainly had such an impact on you and the work that you're doing.
So I was fortunate enough to, it's funny, things have just kind of come to me over the years. That's why I say I'm kind of a guided soul, I guess. I was introduced to someone that had a machine from when I was living in BC, British Columbia, Canada. And I got to play around with it. And then I got to learn and study different frequencies. And one of the things that I learned that came to me very quickly is electromagnetic frequencies are like, they're utilized to imprint the vibrational signature of substances. Like, you can use carriers with them. Like water is one, and that's, if you watch Water Memory, you'll understand how incredible water is as a carrier, and water has memory, so it's amazing. But what's unique to me is I start playing around with other substances, because that's where I go. I want to play around with things. And I started using lactose, sucrose, salt, and different minerals other than water and playing around with frequency. And what I think, okay, so experimenting on my own friends and family with different substances and frequency, I found that sucrose pellets would hold a charge. And this led me to my current work, which is, as far as I know, the first homeopathic private case study using electronic frequency in a sucrose pellet, which is really quite amazing.
Wow. And so that's part of the homeopathic detox protocol that you're using with COVID, the long COVID and vaccine injuries.
Yes. And I was guided to formulate this specific formula during COVID. At the end of 2020 through the first quarter of 21, I had been doing research and studied several different studies actually that led me to testing this with friends and family. And it was interesting. It was like I was guided. I was like, I had this formula and I'm like, how am I going to find people to try this? Who am I going to connect with? And it was like people just came to me. It was quite incredible, really.
Wow. And so how do these protocols, how do they work? What is their role in supporting the body's healing process for, people that are suffering from long COVID and vaccine injury?
So it's a systems protocol. So in traditional homeopathy, for all of those that are familiar with that, you have like the repeated dose, and you're taking sometimes a tincture, a nano size amount in a pellet or in a liquid. There's different forms of homeopathy, but the basis of it is like treating like. Well, this is a little different. This is electronic homeopathy is what I refer to it as. And you can learn more about it on my website, which we can talk about later. And in this type of homeopathy, I'm doing a systems protocol. So it's basically frequencies to correct systems in the body to trigger a response for the body to heal itself. And each set of pellets are taken exactly 7 days apart because I believe the frequency in each pellet lasts 7 days. So you don't want to cut off the frequency before it's had its chance to work.
Right. So there are different protocols for somebody that might be experiencing like a neurological, like brain fog and things of that nature. And then maybe another for somebody
heart, lungs, digestion. Yes.
Now,
neurological.
What if they are experiencing the perfect storm? I mean, they have all of it. Can they do all of these protocols?
Well, everybody has to do all of them, even though the way this protocol works is, say you're taking protocol A, and say protocol A is addressing the lungs. Okay. You still need to take protocol B to address the gut, the digestion. You still need to take protocol C to address neurological and central nervous system. You have to take it in order, actually. It's very important to reset the entire body for the body to heal itself.
So they're taken consecutively 7 days apart.
Yeah, it's a month-long protocol with one dose once a week.
Got it. Okay, interesting. Now, so have you had any pushback? I'm sure you have.
I've had people call me crazy.
Oh, join the club, sister. But like, what challenges have you encountered like that? People calling you crazy, or people, maybe questioning your sanity. Like, I know people have questioned mine, but what type of challenges have you encountered, and how have you dealt with that when you're trying to promote the use of homeopathy, whether it be complementary or as an alternative approach to conventional medical treatments? How do you manage that?
Well, good thing I'm thick-skinned. Yeah. I go back to being guided. It hasn't been that difficult of a road for me, other than people calling me crazy. And if people are not open enough to try something new, then it's their loss. The protocol will get where it's meant to go.
Right.
People that want and need the protocol will get the protocol. And I've had to let go of having a vision of how I see things go and let this thing just have a life of its own.
Yeah.
So in the beginning, like I was so excited. I had some great results and I was like, oh, everybody's just going to want this. And that's not how it went.
Right.
So I had to just take a step back. And one of the most amazing things happened. I had been living in Canada for 15 plus years, and I moved back to North Idaho in the fall of 2019. And I was kind of guided home. So I know why, because I don't believe I would have been able to get this off the ground in Canada for a lot of reasons. So I felt like I was being guided a bit. And I had opened a wellness center with a restaurant at the beginning of 21 with my older son, who's a chef. And in comes the local PharmD, who I had no prior relationship with. And he was ordering lunch, and him and I struck up a conversation. And I started talking to him about my work. And he's like, well, I'd like to try that. You know, I've got a lot of patients that he actually said vaccine injured, and this was in the spring of 21.
Wow.
And so I said, well, he goes, well, can I try one of your protocols? And so I let him try it. He came back a month later and he said to me, Jen, this protocol worked. How can I help you? And then I said, well, we need to run a clinical trial or a case study. I said, because this isn't a product that's FDA approved. We can't sell it. I go, but we can run a case study. He was my first practitioner to sign up to run the case study. I think he's got like probably 400 or 500 cases now. And he reports that he's got an 80 to 85% positive response and full recovery from long COVID symptoms.
That's amazing.
And since then, word of mouth's a powerful thing in the community of a lot of Western medical professionals that actually wanted to go more integrative, which I'm very grateful for. I never thought I'd see the day, but we are, and it's wonderful. I now have 10 practitioners. Some of them came from Western medicine, and some are naturopaths or homeopathy practitioners. It is incredible, actually, what has happened. And I even have an MD and a naturopath in Canada that run this case study now. So it's just been a beautiful, incredible journey for me.
That's amazing. And, I think you kind of hit the nail on the head with when you're talking about the Western medicine practitioners are finally coming over to the other side. I'm very allopathically trained as a nurse. I've been in healthcare for 28 years. And I was never, it's not that I'm not open to other alternative therapies, but, we've all been conditioned to think of it as quackery. So I can imagine that I wasn't completely closed off to it, but I also wasn't, embracing them with open arms. And I was very, very skeptical, because that's pretty much how we're trained to be, very skeptical of anything that is not towing the line of, the FDA and the CDC and all of those captured 3-letter agencies. But COVID was really eye-opening to me personally, and to I know a lot of other nurses. So when I came out of the system, really questioning everything and realizing that I was going to have to learn how to nurse from a completely different perspective. And that's when I went and received training in functional medicine and more holistic modalities. I was recently trained in homeopathy as well. So I think, and there are so many nurses just like myself, so many doctors even, that are now really embracing these alternative therapies. And I'm so encouraged to see that. That's why I'm excited to be working with you and what we're doing at Remnant Healthcare. I definitely want to bring you back and have you do like a webinar. I would love to have you do that with some providers that are coming on board and see, how we can start rolling these out. We have so many people that have been vaccine injured, and we talk about the conventional medical model turning their back on these alternative approaches, yet they're completely abandoning these people who are suffering from these vaccine injuries and these adverse effects. They're not helping.
That's horrible.
They just gaslight them. It's awful.
That's horrible.
I'm really encouraged to see that there is a light at the end of the tunnel for so many of them. I know so many who are suffering. So I really, really want to work with you and get you with this group of vaccine injured that I've come to know and have been working with through my work with Nurse Freedom Network and Remnant Healthcare. And I think that we can do a lot of good for these people. I'm very encouraged.
I am too. I mean, we need balance in everything. Everything works in balance. So, I mean, for me, seeing a more balanced healthcare system in the future it's promising, it's encouraging, it's a wonderful thing. So I like to focus on the positives, Kimberly, because honestly, COVID brought out a lot of negative, but there's going to be a lot of positives, and balance is everything. It really, really is.
Absolutely.
So a lot of people don't know there's really good work going on all over the world. I just learned about what's called a new test to test for spike protein called the basic S1 immune panel. Are you familiar with that?
So I've heard that something is in the works, and do you know how close we are to getting that to market?
Well, I actually, if people want to contact me through getdetox.us, I can put them in touch with someone that can get them on a list if they want to be tested to see if they actually have the spike.
I would personally love to be, I mean, I'm certainly not vaccinated. I'm not vaccinated, but shedding and there's exosomal transmission there. I think that we're all exposed at this point. So
well, you call it shedding and I call it frequency, but yes.
Yeah, exactly. So I would really be interested to know if I have any of that circulating in my body. What is the price point for something like that? Do you know?
I believe the test, just the cost of the test is going to be around $360, and then there's going to be like an intake fee from the practitioners that run it, so there'll probably be $200. So you're probably looking at like $560 total.
Okay, and so this is something that we could potentially offer at Remnant.
Possibly.
Yeah, that would be amazing. We'll definitely talk more about
possibly.
That. Yeah.
So it's encouraging though, because then what I love is I love measurable results. See, people always, not all people, but there's a lot of naysayers out there, like you said, that mock this kind of thing. And electronic homeopathy isn't even traditional homeopathy, so it's a whole different level. And that's okay. However, if we have basic S1 immune panels done, and then we do before and after, we'll have measurable results.
Right. So is this a quantitative result where we'll be able to measure the amount of spike protein, or is it just detecting the presence?
I believe it's going to be measurable.
And excellent.
I know, I'm excited too.
So we can see, the progress from the detox protocols and how that is affecting the presence of spike protein in the body. I think that is absolutely incredible. And I would really love to talk with you more about that and see, if we can get maybe a case study going with some of the injured that we have.
That is going to be incredible. I was excited because I have worked with a microbiologist in the past, and we did some live blood analysis prior to, during, and after my protocol. And we could see significant results with that. But I'm really excited about this basic S1 immune panel. That's exciting. But I feel pretty confident that I'm going to have measurable results.
Oh, I'm definitely looking forward to this. This is something that I know has been in the works for at least, I know I've been asking about it for at least a year. I did hear that, that something was being worked on, an assay was being developed, but I didn't hear anything about when exactly that would be coming to market. So I'm excited to hear that there's something coming down the pike relatively soon that we'll be able to measure and get us some real hardcore data, which is what, I'm very data driven. I believe you are as well. So I think that is something to really look forward to.
I really am, because like I said, with my work, people just, they look at me like I'm nuts half the time.
Right.
And it's not until somebody tries my protocol or works with me, and then they go through a period of disbelief, which I enjoy that, actually. I love it.
And I will say this, so I have like a love-hate relationship with the term protocol. Because I don't like, because of protocol, protocol driven medicine, I think is really what kind of got us into a lot of trouble, particularly during COVID. I think that is what, the immense loss of life that we saw during COVID, certainly not due to a virus, most definitely due to the protocol driven approach that we had when we're, blocking safe, effective therapeutic medications and only sticking to things like remdesivir, ventilator, and death. It's like a
well, it is death. What do you want? Kidney failure there? I mean,
exactly. So when I hear protocol, I almost have like this just really visceral response to it, because I'm a very big believer in individualized healthcare. Now, but so the specific protocol, for lack of a better word, it is, and you said that people have to do every bit of it. But is there a way that it is customized at all to the individual needs and symptoms of these patients that are recovering from, because they are very varied.
So it doesn't matter what their symptoms are, Kimberly, because if the protocol delivers results, it's a full body reset.
Wow.
Okay. So the whole body is resetting and healing itself, whether they have a heart murmur, whether they have neuropathy, whether they have chronic fatigue, brain fog, shortness of breath, lung capacity issues. The whole entire 4-week protocol needs to be taken for that body to repair itself.
Now, what kind of results are you seeing? So some of these people were injured very early on, 2020, late 2020, 2021. Yep. Are you seeing progress made with people who have been suffering from long-term effects? Or what about even going back before COVID and people who have had vaccine injuries, just from the childhood schedule, let's say, or have, been suffering for years?
I had a provider that reported, because I work through providers because I'm not one, right? So I'm the formulator. So I had a provider report to me that he had a family that was exposed to radon. Oh. And they took the protocol and they got better.
Amazing.
So if we do have, not everybody wants to go on the website, including practitioners. Some of my practitioners are on our website and some are not. But if people go to the website, getdetox.us, at the bottom of the homepage, they can learn about this work, and they can also watch some live videos from some of the case study participants in this case study. Because again, this is the case study. There's an enrollment fee to the provider. It's not that expensive, the enrollment fee. It supports the work, and there isn't any product for sale here. So I want to make that clear.
Right. And that's because that's a big issue for a lot of the vaccine injured. They are getting products pushed on them all the time. They're very, very skeptical. I don't blame them, because they are, like I said, they're gaslit by their medical community, pretty much abandoned. And then, we have an issue of oversupplementation. I think that is a problem as well. And of course, not everything is going to work for everybody, right? What one works for one person may not work for another. That's very true. And I don't like to discount anybody's healing, but I think that it's so important that we keep in mind that the people have been very financially devastated by these injuries, and they have people pushing different products and different protocols on them that basically can't afford.
I agree. I agree 100%. I totally agree with you. And we've even got big names in what I would call this movement from doctors that are turning away from Western medicine and whistleblowers, big names, and they're pushing products, and their products are more expensive than enrolling in this case study, which to me, I have my own opinion.
Yes.
I'm just going to say that.
Yeah, we all have one, I'm telling you. And not to say that I think, like I said, I think there's value in some of them, but they're just, the injury community is tired, frankly, of having these things pushed on them. They feel like they're being taken advantage of, and in many cases they are.
I
And
agree.
and they're being further victimized, and it's very, very important to me that we protect them from any further harm. I mean, they've already encountered so much, and for me as a nurse, for me as just a human, that is why I can't stand to see human suffering. I just can't stand it, and I see it happening, and I see people making promises that they certainly can't keep, and really,
So for me, there's
devastating people.
Yeah, for me, there's no promises, okay, because everybody's body's different. My practitioners are reporting wonderful response rates with people's conditions through this case study. This is a case study, one of the first of its kind, and it's privately funded, okay? Because nobody with any big money or big pharmacy is going to fund this,
Correct.
Okay? So these are a lot of these practitioners are giving hours of their time to this. Okay. And, they charge what, a $99 enrollment fee? I mean, seriously.
Right. Exactly. It's
so, I mean, this is yes. And you get the protocol, and, honestly, why would we do this? And why would all these practitioners be involved that are licensed even if we weren't getting results?
And with homeopathy, there is no side effects typically. Is that correct?
No. With homeopathy, and specifically electronic homeopathy, it either does something or nothing. Yes. And if you start feeling flu-like symptoms or a little worse, that's your body kicking in. That's your body's response to detoxing and resetting itself. And then those symptoms generally pass within 2 to 3 days. Right. And then your body starts the healing process.
A lot of people mistake that Herx reaction to and classify it as an adverse
the Herx reaction. Yes.
That's not an adverse event. That is the actual detox, the toxins being released from your body. So that's actually a very good sign. And
yes, it is. And so sometimes, that's the practitioner's job, running the case study, to make people aware of that to be happy if you actually feel something, even if it's negative.
Exactly.
So your body's kicking in and doing. Yes.
Education. We have to, as practitioners, and I cannot stress this enough, we have to be educating on what to expect, because otherwise they're going to think it's an adverse reaction. They're going to stop it. And then they're not going to see the full benefits that they could. We're up against a break, but when we come back, we're going to dig into this a little bit further. America Out Loud Talk Radio plays on the iHeartRadio network. You can also listen on our media player from any web browser anywhere in the world. We have the best in-class apps available on Apple, Android, or Alexa, 24/7. Great Talk Radio. All of our shows go to podcast the following day. You can hear them on apps such as Spotify, Stitcher, Pandora, iHeart Podcast, and many more. Be sure to subscribe and rate the show on Apple Podcasts for me. Don't forget to check out our online store at americaoutloud.shop, where you can find all of the products that we represent on our network at a discounted rate. I'll catch you on the other side of this break. Stay with us.
It's time, and this is
world-class care from doctors you can trust, all from the comfort of your home. That is One Wellness. Dr. Peter McCullough and his team at The Wellness Company launched the One Wellness membership to provide free monthly supplements and unlimited telemedicine access with doctors that share your values. Be a part of a revolutionary new healthcare system that puts your health and well-being above the interests of Big Pharma's bottom line. It's the way healthcare should be. Go to OutLoudCare.com today and use code OUTLOUD for 25% off your first month of One Wellness.
86 million of us suffer from the silent killer, high cholesterol. Left unattended, we are at risk for heart attacks, strokes, and more. Meet HealRight, the ready-to-eat bar that lowers cholesterol naturally in just 8 weeks without the side effects of statins. HealRight isn't just effective, it's delicious in 4 flavors, and it works without diet or lifestyle changes. Go to HealRight.com/OutLoud and use code OUTLOUD for 20% off your first order. That's HealRight.com/OutLoud, code OUTLOUD for 20% off.
58 million people suffer from joint aches and stiffness in the U.S. every day. Ignoring chronic joint discomfort can affect mobility and your quality of life. Advanced nutrition company Healthy Cell created joint health and mobility to support connective tissue, joint lubrication, and reduce joint irritation with curcumin, omega-3, chondroitin, glucosamine, and hyaluronic acid for joint comfort and flexible range of motion. And Healthy Cell's not a pill. It's a patent-pending gel you swallow with clinically proven ultra-absorption of science-backed ingredients. You would need to take 11 pills to get the same amount of nutrients in each gel pack. And these great tasting gels come in a small packet. Tear off the top, shoot it down, or mix it in water. It's 100% drug-free joint support. Go to healthycell.com and use code OUTLOUD for 25% off your first order. healthycell.com, code OUTLOUD for 25% off.
I'm Dr. James Bragman. Do you suffer from allergies, sinus problems, or just seem to be getting sick more often? You're not alone. Many of my patients are finding relief with Cofix RX nasal spray. I've relied on the sanitizing power of povidone iodine for years. Cofix RX has harnessed that power to help cleanse germs, allergens, and viruses in your nasal cavity. You brush your teeth and wash your hands daily. Stay healthy by using Cofix RX to wash and cleanse your nose daily. Get Cofix RX today. Go to America Out Loud Shop and click on the Cofix RX banner, or type in cofixrx.com/outloud. Buy now and receive a 20% discount with a 30-day money-back guarantee.
The buildup of spike proteins is dangerous to your health. Global Healing's Foreign Protein Cleanse detoxes your body, removing the spike proteins, allowing your body to repair from within. Formulated by Dr. Edward Group and by Dr. Brian Ardis, Foreign Protein Cleanse targets and detoxes spike proteins in the body. Go to americaoutloud.shop and get 15% off using the code OUTLOUD. Global Healing, giving you the power to take control of your health naturally.
I'm so confused. I don't know what to do.
I'm afraid of going to the hospital.
My doctor tells me nutrition doesn't work.
Trust is earned. We are the Energetic Health Institute, and we want to earn your trust. Natural medicine, holistic nutrition, detoxification, fasting, cellular healing, and so much more. Remember, the best way to be free is to be healthy. So stop being a patient and start being a student at energetichealthinstitute.org.
Many voices, one freedom, united in the First Amendment. Our goal is to herald the voice of genuine liberty at AmericaOutloud.news, a place where you'll find the naked truth expressed with a patriotic heart. Now is our time, my fellow Americans. America Out Loud Talk Radio. Liberty and justice for all.
Welcome back to Nurses Out Loud on America Out Loud Talk Radio. I'm your host, Nurse Kimberly Overton. Wherever you're listening from today and whatever you're doing, I thank you for giving me the gift of your time. Be sure to make AmericaOutloud.news your daily stop for all the latest news and happenings. We all must do our part and share the stories, the articles, the podcasts, and videos so we can help secure America's future. If you're just joining us, I've been talking with natural product formulator and researcher, Jen Dillon. Let's jump right back in. Jen, thanks so much again for being here with me today, and for this information is incredible. It's incredible.
Thank you.
So encouraging.
It's my pleasure. I've always been the type of mind that wants to explore anything I can.
Yes, same. I think that's why I really just as soon as I met you, we all did. Everybody on the call just felt so electrified after hearing about your work and your research, and you could really see the passion and hear the passion in what you're putting forth. So it's such a blessing. But I really want to learn more about the electronic frequency components and, what other commodities are you using with these protocols?
Just electronic frequencies, and they're utilized to imprint vibrational signatures of substances into carrier mediums. Okay, So for instance, electronic homeopathy utilizes the principles of like the quantum biophysics, if anybody's familiar with that, to imprint a vibrational signature of a substance onto the carrier. Now, the carrier could be saline solution. The carrier could be water. And in my case with the protocol, the carrier is actually a sucrose pellet, which was quite amazing, but it works. So that's unique to me, I believe, which I'm really excited about. I've also worked with water a lot. And when I was first working with water, I used it as a carrier, but it only holds the substance, the frequency. It only holds the frequency for a very limited amount of time. And then I found a water source that had the right amount of minerals and particle size that I could charge the frequency to, and it would hold the frequency.
Wow.
And that was kind of a miracle, because I had been directed to play with the water, and I knew I needed to do something with the water. And I had specifically been given a frequency that I felt was really going to help people's immune system, hydrate their cells. I really felt like I needed to create this structured water, and I didn't know how I was going to do it, because you can't sell water unless it's FDA approved, and you can't create a structured water unless you have the right mineral content to hold a long-term charge.
Right.
So I was completely guided, and I met a gentleman that had a artesian spring water source near my community that had gotten FDA approval to bottle the water, and he wasn't really doing much with the water. And his facility was on the top of the mountain in the middle of nowhere. It wasn't, logistics was not very well thought out here.
Right.
And I met this gentleman, and at first he thought I was nuts. He told me later, he goes, "I thought you were crazy." And I said, "Can I test your water?" And he goes, "What do you mean?" I go, "I want to create a structured water, and I really would like to test your water." And then we probably talked for a few weeks. And then I finally said to him, because he wasn't going to let me do it. And I said, "Hey, how much would you charge me to do one run of your water? Like, I'll pay." And he's like, "Okay." And he gave me the amount of units. And I'm like, "Okay, I'll pay you." I go, "Will you let me charge the water?" He goes, "Well, what's involved in that? You can't touch the water. You can't do this. You can't do that." I go, "If I show you what I do and you have any problem with it, if it's not sanitary," I go, "you tell me." Okay. So I go up the mountain to this crazy middle of nowhere water bottling facility with this amazing artesian spring water. And to my surprise, it works.
Wow.
I didn't even know if it was going to work. But the way I met this guy was so incredible that I'm like, I got to test his water, even if I have to pay for it. And he was absolutely astonished. And I'm going to use the word astonished, because he tasted the water that we bottled after I structured the water and charged it. And he's like, "It tastes different than my water." He's like, "How is that possible?" I go, "Because it's not the same water."
Right. Right. I
And
have
he's
living
like,
structured water.
So the water is called H2O frequency. And I started giving this water out to providers that were already involved with me. And I put all kinds of people on the water to try the water. I've had people drinking the water since December, this past December. I have cases reporting hair growth. They don't need lotion anymore. No more dry, cracked skin. It takes about a month on the water, and you don't need lotion. Your skin tone changes because you start producing a little more melanin. You get a nice shine to your skin. It's quite amazing.
I'm going to have to get on this water, Jen.
Yep. This water is amazing. So I always tell people, we have what we call the 18-day challenge. Prove it to yourself. If you decide to buy a 6-pack of the water, which one bottle is 3 daily servings, it's suggested to drink a little over 5 ounces a day, because this is a water supplement. It tastes like water, but this is not regular water.
Right.
So this water, we believe, it does amazing things. And I tell people, prove it to yourself. If you're willing to buy 1 6-pack of water, I'm pretty sure you're going to be hooked. That's 18 days of water. And at the end of the 18 days, you know, take pictures of your skin, your chest, your face, your hands, wherever you're dry, just for yourself. Do close-ups. And then at the end of the 3rd week, the 18 days, go back and look at your skin.
Oh.
Yep.
So how many ounces are you taking per serving?
5 ounces.
Okay, gotcha.
5 ounces. Although, if I have a headache or something, I'll drink half a bottle.
Yeah.
But 5 ounces is all you need daily. And, you know, structured water has been shown to be more easily absorbed by our cells, which creates that hydration at a cellular level. So it's amazing. But what's truly amazing is the fact that I found a source that had the right amount of minerals to hold the charge. So it was really, for me, it was just like, this was just meant to be.
Exactly. The orchestration that you see happening. And I've said that, you know, from the very beginning, and I felt very called to the path I'm on. And it seems like everything is just perfectly aligned and orchestrated, and the people that we meet along the way and all of us coming together. I really don't feel like that it's a coincidence at all.
No, everything I have really been working on, specifically the past 4 years, has all been guided. Absolutely. 100%.
Yes, I could not agree with you more. So I'm definitely excited. I'm going to try this water. So we'll make sure that we include a link to get the water, the 18-day trial. I will do that. And then I'm going to do a follow-up on my show to see how I do on the water, because I'm definitely looking for really anything that can get me on a path to better health. You know, I'm really struggling. I'm at that point in my life, and all my listeners know I'm going through menopause. I'm very open about it.
Right.
I think every time I forget what I'm going to say on the show, I blame it on menopause. So they get it. It's the brain fog and all that. So I think I'm going to have to try. I don't have long COVID and I don't have vaccine injury, but will this protocol help me with my symptoms from, you know, just
well, here is another thing, and I'm going to say this is my opinion. Okay. My opinion is that we are all extremely dehydrated.
Yes.
And mineral deficient. Okay.
Yes.
So most of the bottled water in the stores has no significant, if any, mineral content. Okay. It's been depleted. And some of these high alkaline water bottles that people are buying, thinking they're so good for their health, if they're too high of alkaline, they are not good for your health, in my opinion.
Yeah.
And in some cases, you are completely depleting yourself of salt and shutting your cells down slowly. So, structured water is an amazing, amazing thing to have to help with cellular hydration. And I also tell a lot of people, you know, get some Celtic sea salt and add a pinch of that to your water daily, because most of us are not getting the salt content that we need, the mineral content that we need. And that's a topic that's not widely discussed. I mean, people think, oh, I'm going to pound all this water. And in some cases, they're pounding too much water and they're hurting themselves because it's the wrong kind of water.
Exactly. So, and I think there's a lot of push. There's a lot of different types of water out there. Like you were saying, you know, they have the alkaline waters are on the shelf, and everybody wants to make, you know, the right decision. And there's so many options out there. So I'm definitely looking forward. I will try the water, and I will follow up with my listeners and let them know what type of results I'm finding with them. And I'm going to try this protocol as well, just, you know, for the hell of it. So because I'm sure
Well, your energy level might go up. And if you have any brain fog, that might go away. I've done my own protocol and my energy level has gone up every time I do it.
Yeah. Yeah. I like to do it because, I don't like to encourage things that I don't try myself and get results. I like to be able to personally speak to anything that I encourage or promote to people. So I definitely want to try the protocol myself. And then we're definitely coming. I'm going to bring you back on for a follow-up episode on Nurses Out Loud. If you'd be happy to join me again, I would love it.
Oh, I would love that too. And I would love to talk to more nurses and practitioners because I believe that, if we can get some more providers on board, this is just going to continue to grow. And I believe it has huge potential to help so many people. And it's not a costly route to go to try it, right?
Right, exactly.
And you're supporting something outside of Western medicine that has potential to help so many people.
Yes. Well, I'm so encouraged by that. And I think we've got this incredible educational platform that we're launching through Remnant Healthcare, where we're in partnership with Odom, which is an educational platform and marketplace. So I'm excited that should be launching here in probably next month or so. And we are inviting, formulators, practitioners, educators on to offer courses on our platform that, whether that be to the general public or to other practitioners. So that's something, if we haven't talked about that yet, that I want to make sure that you and I have a discussion about that, because I would love to be able to offer this for not only our practitioners, but also, just the general public. I think everybody needs to know about this.
Absolutely. Sounds wonderful.
Yeah. Fantastic. Well, Jen, we are almost out of time here. Is there any parting thoughts that you want? Actually, I really want to ask you, as far as just the role of homeopathy and natural product formulation as it's evolving to treat long COVID mRNA vaccine injuries. What are your hopes for the future of integrative medicine in this context? And then we'll leave it right there.
Oh, I am hoping that people are going to be more open.
Yes.
I feel like there's been a lot of programming and people were programmed to just accept one way to treat everything in one system. And I am seeing people coming out of that shell and being more open to what they think doesn't sound normal to them, but maybe I should try this. Balance, like I had mentioned before, you can't have something without balance or it just doesn't work, right? It'll always eventually crumble. Yep. You need balance. And I am so encouraged by just what I've witnessed just during COVID and since COVID, with there's some really good doctors out there that just aren't going the Western med route solely anymore. And I'm grateful for that. And it's encouraging to see, but I am hopeful that we're going to continue to see more balance and openness. And I mean, like, I didn't really touch on quantum physics. Quantum physics is something I'm very, very into. And I think we may even see a quantum system of a medical system of quantum in the future. And that's something I hope people will be open to.
Yeah, I think more and more people are going to be open to these alternative therapies. I think COVID had a lot of, as tragic as it was and everything that we have been through collectively, I see so many silver linings of that. And I think that, being the openness that we're seeing now to these, integrative medicine and more natural and holistic modalities is definitely part of that.
Yep, 100%.
Yeah.
It's a beautiful thing.
It truly is. It truly is beautiful. Well, we'll make sure that we include links to everything that we talked about today in the show notes, including that incredible documentary, Water Memory. Mm-hmm. Yeah, we'll include that. We'll include links for you to try the water and for these incredible detox protocols. And of course, for Remnant Healthcare, where we can assist you in all of that. Jen Dillon, thank you so much for joining me today. And I look forward to talking with you again real soon.
Thanks, Kimberly.
And that is all the time that we have for today, friends. But remember, we are here on the air 5 days a week, Monday through Friday at 10 a.m. Eastern. You can also catch the encore at 11 p.m. Eastern Standard Time. Please be sure to tune in and listen to myself and my amazing sister nurses. As we walk you through all of these hot topics, we will empower you with information and education. We will advocate and we will stand in the gap for you because we are nurses and this is what we do. I'm your host, Nurse Kimberly Overton, and you can find me here every Wednesday morning at 10 a.m. Eastern. Until next time, be safe, be well, and God bless. Remember that we are in a war for truth. We are putting out a bounty on the real misinformation and exposing the purveyors of propaganda. No topic is off limits as we shine our lights and expose the darkness.